Welcome to our Before It's a Crisis video series, where we cover practical topics and tips that support teen suicide prevention. This quick video is about youth suicide prevention tips. Suicide is the second leading cause of death in young people and has been steadily increasing. For each suicide death among young people, there may be hundreds of suicide attempts. And for some youth, the incidences of suicidal behavior are even higher, including those involved in the child welfare and juvenile justice systems, part of the LGBTQ+ community, who are American Indian or Alaska Native, or military service members. By understanding the risk factors and recognizing potential warning signs, you can help be the preventative eyes and ears for youth with suicidal intentions. It is important to be aware of who is more at risk of engaging in suicidal thoughts and behaviors. Some suicide risk factors are a recent or serious loss, such as the death of a family member, close friend, or pet. This could also include a separation or divorce of the youth's parents, a breakup with a partner, or even a parent losing their job, or the family has lost their home. A mental health diagnosis, including depression, anxiety, behavior disorders, or ADHD. Although having one or more of these does not automatically lead to suicide. Youth who are struggling with their sexual orientation in an environment that is not respectful or accepting of that orientation. The key here to remember is the struggle is in an unsupportive environment and not that youth are a part of the LGBTQ+ community. Lack of social support, such as feeling that you don't have friends or family that the youth can connect with for support. This can cause a youth to feel isolated so much to the point that they feel suicide is their only way out of coping with problems. Bullying. Not only kids who experience being bullied are at risk of suicidal thoughts and behaviors, but also children who bully others are also at an increased risk. Cultural and religious beliefs. Some cultures and religions believe suicide is a noble way to resolve a personal dilemma. Stigma that is associated with asking for help. Youth who are in an environment or have a belief that there is guilt or shame when expressing suicidal thoughts can make someone feel even more hopeless or helpless in that suicide is the only way out. Family history of suicide. This can be very significant and concerning. Trauma, including experiencing domestic violence, child abuse, or even neglect. Lack of access to resources, whether it is transportation, financial costs of services, or even language barriers that can prevent someone from having access to the support they need. And finally, prior suicide attempts. What do you need to watch for with youth in these at-risk groups? Warning signs of suicide may include isolating from friends and family, having problems eating or sleeping, mood swings, reckless behavior, dropping grades in school, increased use of drugs or alcohol, giving away their belongings, making statements about wanting to die, researching means for suicide, expressing hopelessness about the future, feeling that they are a burden to others, and feeling alone or that they do not belong. These warning signs are serious. So what do you do if your teen is exhibiting one or more of these signs? The first thing to do is to talk to them. Express your concern openly and honestly. Ask the question directly, are you thinking of harming yourself? Really listen to the youth without judgment. Be empathetic, don't blame or shame. Tell them you hear their pain and you are here to support them. Remind them that they are not alone. If the teen isn't actively suicidal, you can help them by maintaining a connection with them, assisting them in connecting with friends and loved ones, and ensuring that they know where to turn if needed, both locally and by accessing the 988 Suicide and Crisis Lifeline. If the teen admits to having thoughts of self-harm, prioritize safety by removing weapons from the house and ensure that they aren't left home alone. If they deny having suicidal thoughts, but you're having doubts of their honesty, it is important to trust your intuition. Talk to their mental health provider or call or text the 988 Suicide and Crisis Lifeline for immediate assistance. You or your teen can call this line together and someone will answer your questions and get you the help you need. We hope you found the information in this video valuable. For more suicide prevention topics and tips, visit our Before It's a Crisis page at nexusfamilyhealing.org/before crisis.